All right, someone's been doing their homework. Looks like you've got notes on all sorts of respiratory meds, huh? It's acetylcysteine, theophylline, even pancuronium. Wow. Ready to take a deep dive with me and see what we can learn about this stuff?
Absolutely. I'm always up for a good deep dive. It's pretty amazing how many different medications we have to help people breathe better.
Right. And there's so many. Maybe we should try to organize them a little, put them into categories or something. We're talking about everything from a simple cough to some pretty serious infections here.
Yeah, good idea. Let's see, we've got mucolytics, corticosteroids, antibiotics, then we have the anti-tuberculosis medications, bronchodilators, and even a neuromuscular blocker with that pancuronium.
Okay, that's helpful. So let's start with something everyone's probably familiar with, mucolytics. Acetylcysteine is on the list, right?
Yeah.
That one's pretty interesting because it seems like it has a bunch of different uses.
It does. Most people think of acetylcysteine for breaking up mucus, like for COPD or cystic fibrosis, but it's also used to treat acetaminophen overdoses. It's pretty remarkable that one drug can do so much.
Seriously. It makes you wonder, though, how can one drug do all of that? Is there like some connection between getting rid of mucus and, dealing with a toxic overdose?
Actually, yeah. It all comes down to acetylcysteine's ability to bind to this toxic metabolite that's produced when your body breaks down acetaminophen. So by binding to it, it helps prevent liver damage. And as you said, it also breaks down those bonds in mucus, making it thinner. So yeah, two totally different processes, but they both work because of the same chemical properties.
Wow, that's a great example of how knowing a little chemistry can help you understand how these medications work. But okay, I got to ask, what's the deal with the rotten egg smell? I mean, I get that if it works, it works, but that can't be a good selling point.
Uh-huh. No, I guess not. The sulfur in acetylcysteine is what gives it that lovely aroma. But hey, you know what they say? Clearer airways and a healthy liver are worth a little bit of a stinky smell, right?
I guess you're right.
Yeah.
Okay, moving on from the fragrant world of mucolytics, let's talk about corticosteroids. Beclomethasone is on our list, which I know is used a lot for asthma and allergies. How do these things work to reduce inflammation anyway?
Well, think of beclomethasone and other corticosteroids as like chill pills for your respiratory system. They basically go into your cells and calm everything down. They stop all that inflammation from happening.
So they're not just covering up the symptoms, they're actually getting to the root of the problem.
That's awesome. But I do remember reading something about side effects, especially if you use them for a long time. Yeah, that's true. While inhaled corticosteroids like beclomethasone are generally pretty safe, using them for a long time can have some downsides, like it can thin your bones or even mess with your adrenal glands. So it's really important to use them exactly how your doctor tells you to and talk to them if you have any concerns, obviously. And rinsing your mouth after you use it can help prevent oral thrush.
Right. Those are good things to keep in mind. Okay, let's switch gears a bit and talk about the antibiotics. We have erythromycin and penicillin on our list, which are like the classic antibiotics, right? But with all this talk about antibiotic resistance these days, are they even effective anymore?
Well, they are, but we have to be smart about how we use them. Erythromycin, for example, basically stops bacteria from making the proteins they need to survive. And penicillin, well, it disrupts the formation of the bacterial cell wall, which ends up killing them. Both are still effective for a lot of respiratory infections, but we got to use them only when we really need them. And of course, finish the entire course, even if you start feeling better.
So the finish your antibiotics rule is still super important, huh?
Oh, yeah, definitely. Every time you take antibiotics, it's kind of like you're running a science experiment on those bacteria. And if you don't finish the whole course, you might accidentally help the tough bacteria survive. And that's how we get resistance.
Yikes. It's like we're breeding superbugs. Okay, well, things are getting pretty serious, so let's move on to something even heavier, anti-tuberculosis medications. Your notes have ethambutol, isoniazid, pyrazinamide, rifampin, and streptomycin. That's a lot of drugs. They each have their own job to do, right?
You got it. Treating TB is a long process because that bacteria, Mycobacterium tuberculosis, is a tough one. So these drugs attack it from different angles. For example, isoniazid, it stops the bacteria from making mycolic acid, which is super important for their cell walls. And then there's rifampin, which targets RNA polymerase, and that essentially shuts down their ability to make proteins.
So it's like a multi-pronged attack on those TB bacteria. But I also remember reading that these medications can have some pretty nasty side effects.
Oh yeah, for sure. It's really important to keep an eye out for side effects, especially when someone's on treatment for a while. Isoniazid, for example, can cause peripheral neuropathy, which basically means you get numbness and tingling in your hands and feet. And rifampin, Well, let's just say you'll definitely know if you're taking it.
Wait a minute, is that the one that turns your bodily fluids orange? What's up with that?
Yep, that's the one. Basically, rifampin binds to certain proteins in your body, like in your tears, sweat, and urine, and that's what makes them turn orange. It's harmless, but yeah, I bet it freaks people out the first time they see it.
I bet. So it's not the drug itself that's orange, it's how it interacts with our bodies. That's wild. Okay, we've covered a lot here, from breaking up mucus to battling some pretty serious infections. Before we move on to the next category of meds, though, I'm curious. Out of all these medications, what do you think is the most impactful or even surprising?
That's a great question. I think what always amazes me is how we can actually use medications to target very specific processes in the body. We're not just treating symptoms, we're actually going in there and addressing the root cause of the disease at a molecular level. It really shows the power of scientific research and how smart people can be, you know?
I totally agree. It's like we're peeking behind the curtain of biology and figuring out how to pull the levers. All right, ready to keep exploring.
Absolutely, let's do it.
All right, so we've talked about mucolytics, corticosteroids, antibiotics, even those powerful anti-tuberculosis medications. Feels like we've covered a lot of ground. But we're not done yet, right? What's next on our list?
Oh, yeah, we've got more to explore. You ready to dive into the world of bronchodilators? This is
Yeah.
where it gets really interesting, especially when you start looking at how they work at, like, the molecular level.
Let's do it. I'm ready to see how these airway openers work their magic. We've got ipratropium, salmeterol, terbulatine, and theophylline on the list.
Mhm.
Do they all work in the same way?
Well, not exactly. I mean, they all ultimately relax the muscles around the airways, but they get there in different ways. So, like ipratropium, it's what we call an anticholinergic, which means it blocks the action of acetylcholine. That's a neurotransmitter that tells muscles to contract.
So it's like cutting off the signal that tells the airways to tighten up. That's pretty clever. What about the others? How are they different?
Right, so salmeterol and terbutaline, those are beta-2 agonists. They actually mimic the action of adrenaline, which naturally relaxes those airway muscles.
Okay, so we got two main strategies here. Block the signal to contract or mimic the signal to relax. Cool. But wait, didn't you say something about short-acting and long-acting bronchodilators? How does that fit in?
Oh, good point. So yeah, ipratropium and terbutaline are usually used for quick relief, like when you need help breathing right away. They're kind of like your rescue inhalers. But salmeterol, that's a long-acting bronchodilator, so it provides more control over time.
So it's about choosing the right tool for the job. A quick
Mhm.
fix or long-term management. Makes sense. But what about theophylline? We haven't talked about that one yet.
Ah, theophylline. That one's a bit of a mystery, to be honest. It definitely relaxes the airways, but we're not entirely sure how it works. It might have something to do with stimulating the respiratory center in your brain, too.
So it's like a multitasker.
Yeah.
But I remember reading that theophylline has a narrow therapeutic range. What does that mean, and why is it important?
Oh, that's super important. A narrow therapeutic range basically means there's not a lot of wiggle room between a dose that works and a dose that's toxic. So you have to be really careful with the dosage, do regular blood tests to make sure you're in that sweet spot.
Sounds like you have to walk a tightrope with that one. So it's all about knowing how your body responds and working closely with your doctor.
Exactly. It's all about personalized medicine, finding the right treatment for each individual. And that's where this whole field of pharmacogenomics comes in, which is basically studying how our genes affect how we respond to medications. Imagine, someday, we might be able to predict exactly how someone will respond to theophylline just by looking at their DNA.
Wow, that's incredible. Tailoring medications to your genes. Okay, I'm officially a science nerd now. So we've talked about mucolytics, corticosteroids, antibiotics, those anti-tuberculosis meds, and now bronchodilators. But there's one last medication on our list that's kind of in a category of its own. Pancuronium.
Pancuronium,
Yeah.
the one that causes temporary paralysis.
Yeah, that's the one. It's kind of scary, to be honest. Why would we ever want to paralyze someone, especially when we're talking about the respiratory system? Isn't that like the opposite of what we want?
Right. It does seem a little counterintuitive, but sometimes temporary paralysis can actually be a lifesaver. Like think about intubation when you have to insert a breathing tube. Pancuronium helps relax those muscles so the procedure is smoother and safer.
So it's not about stopping the breathing. It's about like making sure the breathing is supported while they do this critical procedure.
Exactly. It's all about control and precision. And they use it during surgery, too, to prevent any unwanted movements. Keeps the surgical field nice and still.
Okay, starting to see how it all fits together, but it still seems like a high-risk medication. What are the downsides?
Yeah, you're right to be cautious. Pancuronium can definitely cause problems, the biggest one being respiratory depression. That's why they only use it in a controlled environment where they can monitor the patient's breathing and provide support if they need it.
Okay, that makes sense. It's a powerful tool, but definitely needs to be used carefully.
Absolutely. It reminds us that every medication, even the ones that do good, can also have risks. It's all about weighing those risks and benefits, right? Using the right medication for the right situation.
So we started with acetylcysteine, breaking down that stubborn mucus, and now we're talking about pancuronium, which actually stops muscles from moving. What a journey. It's amazing how each medication can target a specific part of the respiratory system. Like we've seen how they work on inflammation, muscle control, all these different things. It's like we've explored all the tools in the toolbox. But now I'm thinking about the house itself.
I like that analogy. And yeah, you're right. We need to understand what's causing these respiratory problems in the first place.
Exactly. We've talked about how medications work, but what about the things that lead to these conditions? Like if we could understand those causes, maybe we could find even better ways to treat them or even prevent them altogether.
That's the big question. And it takes us into a whole other area, looking at how our genes, our lifestyle, and the environment all affect our respiratory health.
All right, I'm ready to dive deeper. Let's
Yeah.
go. Okay, so we've explored all these different medications,
Yeah, we really got into the nitty-gritty of how they work.
like zoomed right in on the cells and everything.
Yeah. Exactly. But now it's time to step back.
Look at the bigger picture.
Right. Think about all the things that contribute to respiratory problems in the first place.
Because treating symptoms is great and all.
Sure.
But wouldn't it be amazing if we could actually prevent them?
Absolutely. That's the ultimate goal. And that's where understanding the role of genetics, lifestyle environment, all of that comes in.
Okay, so where do we even start with all that?
Well, let's start with genetics. It's like the foundation. Certain genes can make you more likely to develop things like asthma or COPD.
So some people are just more prone to respiratory problems from the get-go.
Yeah, you could say that, but it's not like a guarantee. Genes are just one piece of the puzzle.
Right. It's not the whole story.
Exactly. Our lifestyle choices play a huge role, too.
Okay, so like what kind of things?
Well, the big one is smoking, obviously.
Of course.
But even secondhand smoke can be a problem. And then you've got air pollution.
Yeah, that's a big one these days.
It is. All those tiny particles in the air that can get deep into your lungs and cause all sorts of trouble.
So it's like we're constantly assaulting our lungs without even realizing it.
Kind of, yeah. But the good news is we can do something about it. Make choices to protect ourselves.
Like not smoking for one.
Exactly. And you can advocate for cleaner air, make sure your home has good ventilation, things like that.
So it's not just about waiting until you have a problem and then taking medication.
Right. It's about taking care of your lungs, being proactive.
I love that. Taking control of your own health.
Absolutely. And that can extend to advocating for policies that support clean air and protect people from pollution.
So it's a bigger issue than just individual choices.
Definitely. We need to work together to create a healthier environment for everyone.
This has been an amazing deep dive. We've learned so much about respiratory medications.
And the complexities of respiratory health in general.
It's incredible how much we've covered just from those initial notes.
Yeah, we went from acetylcysteine all the way to the bigger picture of prevention and public health.
I hope you listening at home are feeling as informed and empowered as I am. We've explored so many different medications.
Mucolytics, corticosteroids, antibiotics, the whole works.
We've seen how they work on a molecular level, and we've talked about the broader context of respiratory health.
It's been a really comprehensive journey.
Before we wrap up, though, I want to leave you with one final thought. We talked a lot about the science,
The mechanisms, the chemistry.
but it's important to remember the human side of this, too.
Absolutely. Breathing is something most of us take for granted.
Right? We don't even think about it.
But for people with respiratory problems, it's a daily struggle.
So let's approach this topic with empathy and understanding.
And remember that behind every diagnosis, every medication, there's a person trying to live their life.
Well said. So as we conclude this deep dive into respiratory medications,
Let's hold on to that sense of compassion.
and remember that while medications are important, they're only one part of the solution.
We also need prevention advocacy and a holistic approach to health.
Thanks for joining us on this journey. We'll be back soon with another deep dive into a new topic.
Until then, stay curious.
And keep breathing easy.